Hi, and welcome to the Daily V of Dr. Jack Belitz. I am he, and I am a chiropractor in Omaha, Nebraska, here to give you some insight as to what help is available to you given certain issues. The first set of issues that we discussed was dealing a great deal with stress. And today we want to move into one of the highlights of what I love working with, and that is people with really severe back pain. First of all, you need to know that there's a couple of different categories that people fit into. First of all, it could be just pure back pain where the pain just is in one spot and it hurts pretty bad when you get up out of a chair or sit down, or maybe when you're driving, maybe when you're walking, it kicks in. Then you can, of course, get more serious pain where now you have pain that kind of goes up your back, or it will go into a big spasm where you can't do anything, or maybe you have pain going down your legs. So there's different severity of level of pain that we often deal with here at the practice. So I want to just go over some of the regular mild type cases, the everyday, like, you were working in the backyard and hurt yourself type of things that can happen, and how we deal with them here. So give me a second here, and I want to kind of show you a couple of graphs that we can look at so that you can get an idea of what type of pain level people are in. Okay, so this is a graph of a person that came in with fairly normal type of back pain. It was, pretty severe for them in the moment that they had it. It was definitely affecting the quality of life. They weren't able to do the kind of work they wanted to. They weren't able to play with the kids. They basically went to work, sat down at a desk, and came home and sat down in the chair. And it was like that for a few weeks, and they finally decided to come in for care. Now, if you haven't seen the first episode of this particular series, you might not be totally familiar with what these graphs represent, so I might suggest that you refer to that real quick. But just as a summary, basically what we're measuring here is the function of the nerves, and if the nerve function is within optimal limits, a reading that we got from the body is going to be graphed in a white bar. And you can see there is a number of those that are on this graph here. If the reading is showing that there's some problem, it's going to graph it with a green bar. If the problem's more severe, it's going to turn blue. And if it's pretty bad, it's going to turn red. So you can see down here at the low back area, there's lots of red going on there. Now, the fact that we've got a lot of red going on at the top there probably means that this person has a component of the back pain that is hanging out in the neck also. And so we really need to address both issues at the same time so that we can get this person to a very stable state. You may have heard of people that get care for their back pain and they feel good for a couple days, and then they have to go back because the back keeps going out and out and out. And yes, it does give them some benefit, but it doesn't really keep the pain away for a long enough period of time. Well, sometimes that could mean that they have another component, not just where the pain is, but someplace else in the spine, and it's not maybe being addressed as well or as quickly as it should be, and it's causing that back to keep coming out. So that's why I love this kind of graphing situation, because it gives us a really good idea, not just where the pain is, but also where there might be components of the pain that are maybe hiding out from us. So that's about all I want to show you on the graph here. Let me kind of get you back into face mode. Okay, so when we're dealing with back pain, the pain itself could come from a couple of different places. First of all, it could be the low back itself, where the vertebrae are just kind of locked in place, and that itself can cause a lot of problems. Second of all, if the vertebrae are out of place, it could be putting pressure on the nerves that are leaving that area. And those nerves are responsible for carrying impulses from the low back area up to the brain to let the brain know if there's a problem, and then the brain uses those nerves to kind of coordinate the healing activity that needs to take place. Well, if those nerves are being compromised because of a misalignment of some sort, the pain could actually be from soft tissues and muscle spasms that the brain is not controlling properly, or it's not getting the feedback from properly, so it's not trying to fix it. So that is also responsible for a lot of pain. Also, it could be that the pelvic bones are getting locked up. Those have to move every time you take a step and when you bend over, and there's a lot of movement that takes place, and when those get locked up, it can cause a lot of pain also. So there's a number of places where the pain can be originating from, and what my job to do is to go in and figure out what's actually wrong, and then go ahead and fix it. And in this office, we use a very, very special technique called network spinal analysis, which uses very light force in order to create that healing that we need so often. So it's kind of nice because you don't hear a lot of cracking and popping. A lot of people get concerned with that. Not that there's any reason that they should, because it's a very safe thing to do. However, it's still sometimes not fun to hear your own bones crack. And so if you do like the idea of maybe avoiding that, this is a great place to take up that care that you need. Anyway, if we go through the care for a couple of weeks and we get the results we're looking for, where the patient is feeling better, moving better, and everything like that, then we're going to go back in and do another graft just to make sure that we're actually accomplishing the things that we want and not just covering up the pain itself. So let me show you what a re-exam would look like here. So if you remember, this was the graph we kind of looked at first. Well, a couple of weeks after we did that graph, we went in and did this one on the same patient. And you can see what a remarkable difference there is. Let me back out a little bit here so you can see a little easier. All of the red are gone. There's a couple of blues that are left. This person was feeling a lot better. It wasn't quite perfect yet, but it was a lot better. And this graph kind of shows exactly what that patient was feeling. So I like to have this type of before and after tests in the office here, so that we can make sure that we're getting to the root of the problem and it's not going to just kind of keep creeping back into the patient's life. Anyway, that is a great example of how we would treat a average run-of-the-mill type of back pain issue that's going on. Tomorrow we're going to discuss pain that's a little bit more severe and introduce you to some ideas and techniques that we have here that are not quite as prevalent and very unique to this office here, so that you can understand what can be done and some options that you have besides surgery. Have a very happy and healthy day, and I will see you on the next episode.